neutralize the acid, but you've still ingested 2,000 milligrams of calcium. You're going to absorb that. So that's another option for you. So do you have heartburn?
I get acid reflux real bad, so I've been taking Metabolic for years.
Yeah, it would really be best if you could get it on a prescription strength Zantac. You could try getting the over-the-counter Zantac, but that might not be strong enough.
It's not strong enough.
Can you double it?
What, the Zantac?
Yeah.
You can, but it'll actually be cheaper.
It's cheaper to buy a prescription.
If you get a prescription, because then it might be only $5-10, whereas if you go to the grocery store, it's gonna be $20, and then you have to buy 2
Well,
boxes.
one of the games that I guess it's my insurance or the pharmacy plays, if you can get it over the counter, then they only give you a little bit off if you buy it, through a prescription method, and sometimes there's really not a lot of difference in price or whatever. Or
Right.
more.
I think it just,
I'm not sure.
it depends on your insurance, and it also depends on the dosing that the doctor prescribes for you. So, but long-term, that's now all the GI recommendations, is for you to really be on an H2 blocker. So I would probably recommend that.
It's just, if I take that one omeprazole every day, I'm fine.
No,
If I take something else, I tried Zantac for years,
and it didn't do
didn't
it.
work. And
And well, here's the thing, it's almost like anything else in medicine. You kind of have to take the good with the bad. So if you know that omeprazole is the only thing that controls your
I can't say
reflux.
it's the only thing, but it works.
Right. No, proton pump inhibitors by far, hands down, are a better acid blocker than the class of drugs called H2 blockers, which is Zantac. However, the downside with long-term PPI use, so proton pump inhibitor like omeprazole, Prilosec, is that there are now studies that are showing there can be some cardiac issues further on. So but again, it seems to be that way with everything in medicine. Like it helps with this. I mean, the reality is like, I remember my attendings telling me when I was in training, when they were in training in the 80s, they were fixing ulcer perforations like nobody's business. Well, by the time I was in residency, PPIs had now come on the market, and I probably only did in my residency just a handful of patients that came in with perforated ulcers. I now have more, like bariatric patients are more prone to ulceration than the general population. So, I mean, I know how to treat that now, like as a bariatric surgeon, but I definitely have treated more as a bariatric surgeon than in my training. So, which also brings me to one other thing, as we're talking about acid and ulcers. If, especially like in the fall, regardless of the surgery that you've had, if a doctor wants to give you an NSAID, such as ibuprofen, Aleve, naproxen, naproxen, you really should not take that, because you can develop an ulcer fairly quickly in your stomach. You can develop one actually within 5 days.
Really? How's Tylenol?
Tylenol's fine. Tylenol is fine.
It doesn't work very well, but
No.
it's fine.
Now, if you're taking, I mean, if you take ibuprofen like once in a blue moon, that's one thing. But if you're having to take it more than 3 times a week, you will get an ulcer. And you need to be on good protection for your stomach. Because here's the thing. I have a normal sized stomach like that. If I get an ulcer and I blow a hole in my stomach from that ulcer, it's going to be about the size of a dime. So what would happen, I'd call my partner, I'm like, I got a hole in my stomach. And he would take me back to surgery, laparoscopically. He'd just put a little piece of omentum, patch me up. I'd probably have a drain for a week. And then I'd be able to I'd probably start doing liquids a couple of days later. That's if you have a normal sized stomach. If you have a sleeve or bypass or duodenal switch, you get an ulcer. Now instead of your stomach being this big, it's now this big or that big. But the ulcer will still blow a hole in your stomach the size of a dime. So it doesn't care that you now have a lot less surface area. So patients that end up developing ulcers, They can stricture in, so meaning
Mhm.
as they heal, they can scar in and get narrowed, or worse, perforate. And if it perforates, you need a feeding tube, can't eat, you have big surgery, badness occurs. So you can't take NSAIDs. And in the fall, when everybody has these upper respiratory infections and your doctor wants to give you a Medrol dose pack, can't have it. Or at least
Aspirin
call
okay?
Do what?
Aspirin okay?
Aspirin's okay. You should probably take an acid blocker because it can still cause.
Well, I'm going to every specialist in the world right now. So my cardiologist suggests that to fight any kind of problems that I may have with my heart, they think there might be some calcium deposits in there.
Right, then it's best, because here's the thing too. Who cares about your stomach if your heart can't pump?
Yeah.
So you know you gotta keep
You die a lot quicker.
gotta keep those pipes open, you know what I mean? But if you're taking an aspirin on a daily basis, you definitely need to be on an acid suppression for your stomach to protect the lining of your stomach.
But I might get buried wholesale.
You gotta tell her what you do for a living.
I'm a mortician.
You're a mortician. Hopefully you won't need your services for a while. That is,
Well, I wouldn't want to perform on myself.
no,
I'll say that.
that'd be well below average. Yes. Did you have a question for me?
No.
Okay. So let's see. So I have a lot of patients that will ask me about steroids. If you have like bad knees or bad hips or bad back or bad neck, if you want to get an injection in one of the joints, that's totally fine. They'll give you a steroid, but it kind of stays in that joint space. It's not systemic. But if they want to give you a Medrol dose pack or prednisone, they're like, oh, you take this antibiotic and you're coughing up a lung, so go ahead and take this prednisone to kind of bring down that inflammation. Please don't take that. Or if you think you have to, please call your bariatric surgeon first and make sure they are protecting your stomach with an acid blocker that you're taking twice a day as if you already have an ulcer. And even then, you probably really shouldn't take it because you can develop an ulcer very quickly, just within a couple of days.
And this is what's it called again?
Prednisone or Medrol dose pack, so steroids.
Z-Pack.
No, now
Z-Pack, okay.
No, Z-Pack is fine. That's an antibiotic.
Okay.
But, so what you just need to do is ask your doctor, because a lot of times your primary care doctor, they learned about bariatric surgery like 20 years ago. They don't know. They can't remember any of this stuff. They're just like, there's some stuff that happened in your belly and I don't know what that is.
Yeah.
That's generally what I get whenever I'm talking to different people. Even other general surgeons, which boggles my mind. I'm like, a sleeve, it's just a I'm just whacking off some of the stomach. It's not that big of a deal. But ask your doctor if you have an infection or whatever, just say, what kind of drug is this? Is it an antibiotic? Antibiotics are totally fine, okay? So, let's see, what else?
We got a few more minutes. Does anybody have anything you want to ask Dr.
Oh my
Hodges?
gosh, I tell you, I can just run and talk. I could talk to that wall for an hour, clearly. Go ahead.
Gallstones
Yes.
after surgery.
So 30% of patients will develop gallstones after surgery, and about 20% of those patients will need surgery. So that's why we don't routinely yank out the gallbladder.
Is there something that you give patients to prevent them from having gallstones, like pre-surgery?
No, some old school surgeons do that.
Does it work?
No. The treatment for gallstones is to yank out the gallbladder. So, but just because you have gallstones does not mean you have to have your gallbladder out. So 30%. So between Melissa, this gentleman, and me, one of us has gallstones. And since you're asking me this question, I bet between you and me, you probably have the gallstones. But here's the thing, if you're not symptomatic, meaning you're not getting a lot of bloating, and so some people ask, like, how do you feel if you have gallstones? It's like after you eat, if people get like really bloated, they get this bloated feeling. They can get some pain that can kind of radiate to their back. If somebody comes to me and they're like, I hurt right here, I have to rule out ulcer, gallstones, a pneumonia, pancreatitis. But generally the first thing that I'll do is I'll treat them empirically for an ulcer. So I'll give them medicine to kind of coat their esophagus and stomach. I put them on an acid blocker that they take twice a day, and then I get an ultrasound of their gallbladder to see if there's stones or sludge. Now, there are some folks that have a pristine looking gallbladder, but it just doesn't want to contract. So it just kind of hangs out. If your gallbladder's not contracting like it should, and that's not always really related to weight loss, it just kind of is pooped out, it's just not contracting. That's called biliary dyskinesia. Biliary meaning concerning gallbladder, dyskinesia meaning bad movement. That too means you need to get that thing whacked out. But if you're only having symptoms like maybe once a month or so, if it's not that bad, you don't have to be whisked off to surgery. But if you're having symptoms like once or twice a week, I'd probably get it removed sooner rather than later.
Is that, like,
It's laparoscopic and it's just day surgery.
yeah, are the kidney stones are the same?
So-
How does that work? Did you have it before or got it during?
I don't think I had it before. Would that have been something that they would have looked at?
No, you don't test somebody to see if they have gallstones before. Patients are prone to developing gallstones because one of the ways you can develop gallstones is if somebody's had significant weight loss.
Oh, okay.
But pregnant ladies can also get gallstones because pregnancy can also cause kind of some stasis in the biliary tree, and you can develop gallstones that way. Kidney stones, there is a slight risk for developing kidney stones after bariatric surgery. So, also the first thing you gotta get worked up for if you develop a kidney stone is you need to get your calcium levels checked and your parathyroids checked.
Yeah, I've had like 10 kidney stone episodes. I haven't even had any since I moved to Texas 25 years ago. Before that, I had like 10.
Oh, bless your heart, have they checked, are your parathyroids okay? Is all
Yeah.
that business okay?
Yeah, it's just up until I moved, up until 25 years ago, I had like 10 between the time I was 19 and whatever it was when we moved down here.
Oh, wow.
But they were all calcium. They were all, looked like little spiky things.
Oh, yeah. Did your urologist or anybody kind of work you up for
Mhm.
anything? And
I was at Mayo Clinic.
oh, okay,
I lived in Rochester, Minnesota.
Oh,
went to
okay.
Mayo Clinic.
okay.
And it's just my body doesn't process calcium correctly, so I watch. I don't eat a lot of cheese, I don't drink a lot of milk,
Right, and you probably don't take any calcium
and I do
supplementation
not take any calcium supplements.
unless you want to be.
Yeah, now when I had gallstones, I went to him because I thought I had kidney stones, because the pain is very similar in some cases.
Mhm.
And he goes, well, good news is you don't have kidney stones, bad news is you got gallstones.
Exactly. So there's that.
Yeah,
Yep.
but yeah, it's extreme pain, but a lot of times, like, I know it's just my body.
Yeah.
And my calcium levels look good when I get blood
Good.
tests. So as long as I don't force extra calcium, because I was a kid that drank like 6 glasses of milk a day and all that kind of stuff.
Well, and that's another thing too. I think it's important, like as a physician, like you want to treat the patient. You don't just treat a number. And so sometimes your numbers can look okay, but if my patients are having symptoms that, for instance, if they're feeling very fatigued, if they're having hair loss, their iron or protein levels could look okay, and I'm gonna say, you need to boost up your protein, you need to boost up your iron, and then your hair will start growing again. And so you just need to, you gotta treat the patient. Just like you, your calcium levels look good, I am not gonna tell you, even though the literature says bariatric patients need extra calcium. Yeah, you can't handle it. And so that's important. I have a patient that has hemochromatosis, and what that means is that their body kind of stores iron at really, really high levels. And so I have to make sure that, and I'll be operating on him soon, he can't have anything with extra iron at
Does it
all.
flush out eventually?
No, sometimes they have to have bloodletting,
Um,
but it can cause, I don't know, it can cause some issues in the body, but it builds up in the liver. It's bad for your liver. Yes.
Think it'd grow hair on me?
Yeah, obviously I don't have that problem.
Any
Shouldn't
other
happen to
questions for
anybody.
Dr. Hodges?
I could just go on and on and on.
Where are you from, Dr. Hodges?
So I was originally born in Canada, but I've kind of lived all over. My dad was in the oil field, so we lived in New Orleans when I was little, and then we moved to East Texas. So.
Did you go to medical school here in Texas?
I
or
did.
Or Oklahoma, where you should have gone.
Oh.
I went to A&M.
Oh,
I went to A&M, gig 'em.
okay.
So, but yeah.
Well, thank you so much, Dr. Hodges. That was awesome. No other
I
questions?
appreciate it.
Yeah. Well, if there's anything that y'all need or if y'all have any questions, just let me know or ask Melissa and she'll let me know. So, and I really encourage you guys, like, surgery really is it's a really good thing. It's a wonderful tool to help to get you to your goals. It's not just gonna get off your weight. It's gonna help you with high blood pressure, diabetes. There's been several different position statements, like from the American Academy of Endocrinology and AMA, and of course ASMBS, that, I mean, surgery is the only thing that will put diabetes into remission. The only thing. So.
But it doesn't work for everybody, because I am still diabetic.
Well, it
Me
also,
too.
but I will tell you this.
reduced it though, right?
It-
You reduced.
Oh, yeah,
the
I'm
other
not on insulin anymore and all this kind of stuff.
So it depends, there's a couple things. If you've been treated for, what the research shows is, if you've been treated for 8 years or less, and it's been well controlled, and you have a duodenal switch or a gastric bypass, those two are gonna be the best at controlling your diabetes. If you have a sleeve, you'll probably still remain on some of the medication.
Yeah, and I was like 12 or 14 years type 2, so I
Yeah.
just figured my
Same.
pancreas is too damaged that.
Yes, yes, you're probably always gonna need to be on something, but just getting you off of insulin
Oh,
is
gosh.
huge.
Yeah.
Yeah,
But it's great, like
I'm
I've had.
still on it. They still let me on it when it, on an as-needed basis, so.
Oh, really?
Just for old time's sake, I'll give myself an injection.
have you looked at getting a Freestyle Libre, one of the continuous glucose monitors?
One of those.
Somebody
Ah.
mentioned that to, okay,
They
yeah.
said they
Somebody
cover-
mentioned that to me,
cover
but
on.
it just seems kinda, is
You
that sticking
don't
to
even
your
feel
arm?
it. It sticks, it just
But
sticks
is-
in,
is
and
it-
it keeps the last 8 hours, and then you just wave it uses near field communications like Apple Pay.
Yeah.
And you just
That's nice, you're not having to poke your finger.
You aren't poking or anything, it keeps the last 8 hours of your blood glucose, so it's almost a continuous.
How often do you have to
glucose
change that?
monitor. Every 14 days.
Oh, that's awesome.
Where do you get it at? Where do you, I mean, does a doctor have to prescribe it to
Doctor
you?
needs to prescribe it.
And does the doctor put it on you, or do you put it
No,
on?
you put it on. Comes with an applicator and you just push it and press it and it pops in, I don't even feel it.
It's probably like
There's
has a little
something
catheter,
about it.
probably
It's
similar
got a-
to like
Yeah, it's
a.
got just a little needle catheter on the bottom of it, and it's, you need to cover it typically. People have trouble with falling off
Yeah.
if they brush against a lot of things, or if they, like they get real sweaty.
So don't put it here either, put it underneath.
Yeah,
Ah.
the only place it's really supposed to go is on the back of the
Yeah, you see people
But
with
it's just a
pictures all
little-
over here.
thing like this that sticks to your arm.
That's cool.
But look at that if you're having trouble controlling it, because then you just,
It'll give you an overall 24-hour picture of what's going on.
I'm usually like up at like 169, and I'll drop down to a high, like a 130 or a 127, or
That's
I'll be
not
up
bad.
at 136, something like that. Well, I was doing better shortly after the surgery, I'll say that. But I mean, it just gave me some Humalog, just for if I need it type of deal. And I think sometimes that's just the easy way out. It's not the same thing as having to take metformin every single day or anything like that. And and I really don't mind. I don't mind insulin that much, other than the fact that it does make you hungry.
I mean,
There's
insulin, it's a
times
hormone of storage.
I've been so hungry I could eat this tabletop.
I've watched a lot of bariatric, I've noticed a lot of the bariatric or higher protein stuff that's focused on protein seems to have a lot of sugar.
I have noticed that too.
And so
I
you
have
gotta
noticed
really
that too.
watch what you get for snacks and
And
such.
sometimes I just say to heck with it.
Well, I do too, but that's just, that's life.
No.
That's just life.
Thank you very much.
Yes,
Absolutely.
thank you.
Thank you so much,
Appreciate
Dr.
your time.
Hodges.
Yes,
I
yes.
do have a question for you.
Yes, sir.